Greetings and welcome to another edition of Montpelier Connection. This is State Representative Mike Mrowicki from Putney, and I represent the Windham-4 District of Putney, Dummerston, and Westminster. Today I'm here in the Statehouse with Representative Jill Krowinski of Burlington. Now, what section of Burlington do you represent?
Well, first off, thanks for having me on your show. It's great to be here. I represent with Representative Kurt McCormick, the Old North End in downtown Burlington.
Great. Well, it's great to have you take some time to talk about this. Jill and I work together on the House Human Services Committee. We like to think it has the biggest range of services. It's the biggest agency in state government, so there's a lot to do.
Absolutely.
One of the things we're in the process of doing right now is parsing through the budget, and each of the committee people have a part of the budget they're assigned, and then what we do is meet with the Appropriations Committee people, and we go over the governor's proposal. We look at what we think should happen, and then we make recommendations. So what part of the budget are you working on this year?
Several. I'm working on health issues, Department of Health issues, and the Department of Children and Families issues. So as many of you have heard of the challenges that the department has faced around adequately protecting our most vulnerable children and families, looking at what investments and what policy changes we need to make that as strong as possible. Yeah.
One of the things, we've had several hearings already with the Senate, and one of the things that I have taken from them is how often I hear, if we don't put the resources behind this, any policy changes we make are not going to help. So is that something you're looking at as well?
Absolutely. And I think, we have to be very strategic and thorough about the way that we approach this, because really putting more people to help the problem may not be the solution. And there may be other structural policy changes that take financial investments, but also help to strengthen and address some of the challenges that the department has.
You bet, yeah. Well, I know that there's a lot of good work going on right now. Unfortunately, the need for that work continues to show up in headlines and on the caseloads of all the people that are working here. So I'm looking forward to see how we can help protect children better in Vermont.
Absolutely.
One of the things that we've also been looking at is the reality that the opioid scourge really is one of those factors that really does hurt families. And I had a meeting today with one of the designated agency heads who had visited the school in Putney to look at what's happening, because school personnel are saying that they're seeing things from kids they haven't seen before. And it's really important that we try and figure out how we can help not just the kids, but the families, and in turn make things easier for everyone in the school, because it can be really disruptive for a classroom.
Right, and one other thing along those lines that I just got an update on was a part of the budget we passed last year was around naloxone, also known as Narcan, and that is a drug that reverses drug overdoses, and it's a pilot project that we started, and I got an update that over 130 reversals have taken place since that has gone into effect. So that could be potentially 130 lives that have been saved. And it's been wonderful to see this pilot project work, and to help really get people into treatment and the support services that they need. So I think we have more work to do in tackling the opioid issue that we have in our state. And up in Chittenden County, we still have people on waiting lists to get treatment, and that's unacceptable. So we have more work to do in that regard.
Some other big things that we've been looking at that you've been working on for years: paid leave.
Yes, also known as paid sick days.
What's happening with that?
So there's been a bill introduced that would, in the House and in the Senate, they are different bills, but the bill that's been introduced in the House would start paid sick days in the state of Vermont, so that would give people the flexibility to take paid time off for medical reasons, to take their child to the doctor, to pick up their mother from getting a routine exam at the hospital or something of that nature. What we know is that it's really challenging for working families to take time off to do these important, critical, preventative medical, medical appointments, but also there are times where things come up and you can't plan for them, and you shouldn't have to choose between your paycheck and taking your sick child to the doctor. And there's actually been a lot of research showing that the amount of money that we spend in emergency departments because of this issue, it's over $5 million in 1 year in Vermont was spent on that. So this actually will save costs in other areas as well as supporting our hardworking families. And so this bill in the House would start with a phase-in, so it would be 3 years. The first year it goes into effect and then gradually increase to 5 days.
What are some other things that you're working on?
So
equal pay, is that something that's...
So actually I am co-chair of the Women's Caucus here in the House, and one of the topics that we've been working on over the years is equal pay. And 2 years ago we passed an 2 years now, I think, and we passed an equal pay bill that really helped to bridge the divide in what women and men make in this state. So women at the time was making 84 cents to the dollar as men, and we just heard one report, which is just one, but we'll continue to watch to see if there's a trend that the number has gone up to 91 cents, which is really exciting, and we're really proud of that. So we hope to see that continue to increase. Sure. And one of the really great pieces of the legislation allowed for workers to ask for flexible work arrangements without retaliation. To be able to ask your boss if you could work from home 1 day a week and not being fired for having asked that. And we are the first in the country to do that, and that's really exciting. So things around workplace flexibility, work around being able to express breast milk in the workplace. There's actually some grants that have just made available through the Department of Health for $1,000, and I think it might be for up to 15 businesses, but applications are out there, and the deadline is February 20th, I believe.
Oh, great.
And you can apply to help make your business more friendly for women who need to express milk. So
this can be extremely important. I know when my second daughter was born, she was born premature. So initially she couldn't nurse. So the ability to actually, we had a breast pump.
Yep.
So we were able to then take milk and freeze it, but when you need to do it, you need to do it.
Right, exactly.
Those kind of accommodations. And we already have a law, don't we, that makes that allowance in the workplace?
It does, but allowing for and creating space for it and proper space for it is important in two different things.
People need to feel comfortable and have some sense of privacy and comfort.
Exactly. Yeah. So we continue to make progress on that front, but that is definitely something that the Women's Caucus continues to be involved with. And there have been different ideas out there this year around helping gender equality in our state. There have been thoughts about making some sort of provision to have gender equality on our state boards and commissions. We have a lot of work to do there in terms of getting more women on those boards. So, and we're also working on a bill around women in corrections to help, especially the children that are whose parents are in the correctional system, to help better those relations. So, look for more on that bill.
I know, with some of the work I've been doing with the fatherhood groups, fathers in corrections, what we found is that if we make space for them to have visitations, to have special parent time while they're incarcerated, it usually turns into an inspiration for them to do their best to get out of prison and stay out. And I don't know if they find the same thing for moms, but I would imagine the same thing is true. And people make mistakes. We need to make allowances so they can still be parents, though.
And yeah, and even as little as finding space literally at the correctional facility where you can have kid-friendly space with coloring books and toys.
Yeah.
That even makes a big difference.
Yeah, yeah. Now, we have been working ongoing to help families in poverty, to help parents. And recently in our committee, we heard an idea that has some really good outcomes in other countries and other states, and it's around children's savings accounts. Can you say more about that?
Sure. Well, there are a number of states that have various different types of programs, but mainly what it is universal children's savings accounts for college or post-secondary education. Yeah. So the concept is that when you are born, or in some states when you go into kindergarten, a savings account is created in the child's name, and there's seed funds put in. Yeah. Every state has different amounts, but that seed fund gets put in, and then there are different matching programs that are out there, and a financial literacy program that follows the child as they grow up and supports the parents' financial literacy programming as well. Yeah. And what the data shows is that children, low-income to moderate income children who have accounts set up, whether it's $1 to $499, are 3 times more likely to go to college and 4 times more likely to graduate. Those are incredible numbers, and we know that the best way to help get people out of poverty is education. And so if we can help in any way possible to get children access to savings accounts for college, to get them thinking about post-secondary education as early as possible. This is one way that is a common sense way to handle that. Yeah,
it makes a lot of sense for the parents, for the kids, and the outcomes we've seen in research when moms and subsequently kids get post-secondary educations, they get off public assistance and they don't come back.
Exactly right.
It really does break that cycle of generational poverty, and I think it's a great idea. This is something you're sponsoring?
Yep, and this is something that has had a lot of work done over the years, actually, and as chair of the Child Poverty Council, we took a lot of testimony on what other states are doing and how we could create something in Vermont that is a private-public partnership to ensure that we could have a robust program that could make a difference. And so the bill will probably be introduced sometime next week or early the following week, and we look forward to getting that in front of the various committees and getting it to the governor.
I think it's a great idea, and it is one of those, it could be a real life changer for the whole family.
Absolutely. Yeah, when the states that have had it for years now, that we've been able to watch the data, it has really been impressive to see how successful they are and how it can be something that can be a great example of a private-public partnership.
Are there any other big issues outside of House Human Services that you've been watching this year?
Well, one bill that I have been watching is around microbeads. Have you talked about microbeads yet with your audience?
Well, David Dean was on. We haven't talked about it at length, though. David talked a lot about the cleanup of Vermont's waters, but we didn't get into that. Could you share a little bit more about that?
Sure. So microbeads are these little bitty things that you find in cosmetic products, mainly
what are they
soaps.
made out of?
They're made out of plastic.
Plastic.
And what happens is it's one of the cheapest alternatives for manufacturers to put into these products, and they are so think of like when you're washing your hands to help exfoliate your hands, your face, and what happens is these little microbeads get into the waterways. They don't get caught in water filtration plants, and they will go into the waterways. And
they don't break down.
And they don't break down. They actually leach chemicals to them, so they act like a little sponge in the water, and then the fish ingest them. And so this is something that is not only good to help clean up our lake, but also to ensure our this health and safety of our wildlife and our fish. So the bill passed the House. It's currently in the Senate, and I believe they're going to be taking that up in the next couple of weeks.
Great, good work. But what kind of products, is it just one product that we find this in, or is it
Nope.
a range?
It's a wide range of products that deal with, facial or hand soaps. But, the reality is, and what research has shown, is that there are safer alternatives that can biodegrade, and that, plastic doesn't need to be the way to do it. So hopefully we'll be able to get that through.
Now, in the past, what I mean the last couple of years, you've been doing a lot of great work in helping take some toxic chemicals
Right.
out of the environment, especially as they relate to kids. And
Absolutely.
is there something that you're going to be putting forward this year in that regard?
Well, what we are doing is actually monitoring the rule-making process for the bill that we passed last year around comprehensive chemical reform for children's products, which would require manufacturers to label what chemicals are actually in the products that children use, for example, and for like a bubble bath.
Yeah.
If the bubble bath says fragrance in it, they have to say what chemicals are in that fragrance. And so that was a really monumental step that we took in protecting our children and making sure that we're using safe products, and people know. So it's a public health, and it's a consumer protection issue, I feel like. So now that we passed that bill, the state is working on figuring out how we implement it, and so we are closely working on that process to make sure that it's strong, it's clear, everyone understands the rules, and then we can start implementing it.
Now, just to give the viewers a little background, when we say rules here, administrative and legislative rules are what happens. It's the bridge between the law we passed and the practical application of it.
It's a very good way to say it.
and what you're trying to do is make sure the intent of the law is how the law gets implemented. Is that what you're saying?
Yep,
Yeah.
exactly right.
Yeah,
Yep.
great. Well, thank you for that work too. On behalf of kids and families, one of the reasons we're here especially is to protect the vulnerable populations like kids who don't have a say in anything like this. And when there are toxic chemicals in the products for kids, it's up to us to speak up. And you've been great about doing that, and I appreciate the work you've done and keep on doing for that.
Thank you, and thank you for your support.
Yeah, well,
And literally your support in that.
We've got a couple of minutes left here. Anything else that you're looking forward to as the session goes on? We're going to be getting the child protection bill soon.
Yeah.
Anything else that you're going to be hoping that we can get to this year?
Absolutely. There's, again, through our Child Poverty Council work, there's been a steep increase in the number of homeless children that we have in the state of Vermont, and a lot of it is linked to domestic violence. And it is troubling to see that every year when we get a report on the status of homelessness in the state, that the number of children numbers keep on ticking up. And so I don't think that we have a one solution to this problem, but I know that a lot of people are starting to come around the table to say we have to tackle this. What is currently in place is not working, and we need to find some solutions, whether it's in the budget, whether it's policy, whether it's structural, working with our nonprofit partners. How do we address that? So I've been doing some work with some others to figure out if there is a bill that could help at least get this issue on the table in front of everyone and start the conversation of how we do that.
Yeah.
Because in the long-term effects for children who are homeless are, it's really hard. And I think when we talk about prevention, this is one very clear place where we can step in and help make sure that children aren't sleeping in the woods, they aren't sleeping in cars, and that they have a safe, warm place to be.
Yeah. Well, our committee has been looking at the ACE, the Adverse Childhood Experiences Scale, and looking at the research of how when kids have those kinds of experiences, we know they're going to have both emotional and physical health problems down the road. So the sooner we can get to that. And in Brattleboro, we have a great group of workers at the Women's Freedom Center, and I've been trying to do some work with them. We just did a radio spot that different men are doing to highlight that this is a domestic violence is an ongoing issue. There's no news cycle. It's a constant thing, unfortunately, and it's a problem men have to step up and help solve. So it's important that more men stand up, say this is not acceptable anymore, and become allies to this work. So I appreciate that you're trying to continue to highlight this work too, and together, hopefully, we can make the changes we need, because kids deserve a better way to grow up, as do everyone, the women in the family, the moms.
Absolutely.
And it's certainly something we need to keep working at. Anything else you want to talk about today?
I could go on forever. I have so many great things to talk about.
This is the time, and I it's one of the things I appreciate about working with you. We both work on House Human Services Committee, but you do a number of other things, both with the Democratic Party, with the Women's Caucus here. Appreciate having all that. And thanks to all the people back in Brattleboro at BCTV for helping make this happen and bringing our work back to you. Until next time, this is Mike Mrowicki.